Hello.
Hi, Mr. Johnson. I'm Joey. I'm your nurse this morning.
Hi, Joey.
So I'm here to get you some morphine sulfate for that ankle pain, as well as get you started on your new antibiotic regimen for your pneumonia. Okay.
Okay, thank you.
How is your ankle doing right now?
It's pretty sore right now.
Okay. Could you rate that pain for me?
It's like a 9.
9 out of 10?
Yeah, it's real bad.
Okay, I'm sorry. Well, the morphine should help. I'm going to go ahead and get things prepped over here, and we can get you started on that as soon as possible. Just give me a minute, okay?
Okay.
Great. So I've done my hand hygiene. I, at this point, have already done a first check in the med room. I'm going to be here doing a second check now for both the morphine and the antibiotic. All right, so first up, I'm going to prep and check the morphine sulfate. Hey, Mr. Johnson, could you verify your name and date of birth for me really quick?
Yeah, it's Earl Johnson, and I believe my date of birth is
12/12/1938.
That is correct.
Great. And do you know if you have any drug allergies?
I do not have any drug allergies.
Okay, great. Thanks for confirming that stuff. So here I'm going to be administering or drawing down. Yeah, that one's full enough. Some morphine sulfate for patient Earl Johnson, date of birth 12/12/1938 with no drug allergies. Right patient, the right drug. This is morphine sulfate, 2 milligrams per milliliter. It is not expired, so we're good there. I'm supposed to give it now and every 3 hours as needed for pain. He is in 9 out of 10 pain, so we're good to go. I will be doing this via an IV push. Per Davis Drug Guide, I will want to dilute this in at least 5 milliliters of normal saline, and then I'll be putting it into the port in his peripheral IV. He's running normal saline here, so we're compatible. I also know that this is currently running, and so that gives me the clue that his IV site is patent, so that's cool. As I said, we're giving it for pain, and I will document all this in the MAR once I'm done with administration. So I'm going to go ahead and get started on drawing this down. Oh, you know what? Where are alcohol swabs? They're over there. Cool. So I'm going to go ahead and give this a good 15 seconds. And let it air dry. Okay. While that's drying, I'm going to grab a blunt tip needle and an appropriately sized syringe. Now, this is dosed at 2 milligrams per milliliter per orders. I want to administer 2 milligrams, so that means I will be drawing down 1 milliliter. And then I also am going to want to get my charge in here, because it's a narcotic. I'll be able to verify the dose as well as waste it. So, let's see here. Jamie, will you be my charge?
I absolutely will.
Okay, so I am giving Mr. Johnson some of his morphine sulfate for his pain. It's 2 milligrams per milliliter. I want to give 2 milligrams, so I've got a milliliter here.
Perfect.
And we're going to want to waste the rest of this in Pyxis.
Awesome. Thank you very much.
Thank you. Okay, one-handed scoop. Go ahead and set this to Pyxis to waste. At this point, I'm going to grab a couple flushes. One as diluent, one as flush. Cool. Putting this down like that so that I can keep the tip aseptic and give myself a little room here. All right, so 2 milligrams morphine sulfate into the diluent. Mix it. I'm gonna go ahead and push the air out. I'm going to label this as 2 milligrams morphine sulfate for patient. Great. Date of birth 12. Uh-huh. Great. So I have this labeled. I have a flush, so I'll be good to go there. This I will dispense of in the sharps container. Great, thank you. Okay, I'm gonna go ahead and prep my IV piggyback then. So we've already confirmed that Earl's in the room. This is for that patient, that date of birth, and no allergies. This is per orders ceftriaxone. 1 gram suspended in 50 milliliters of normal saline, which we have here. The bag is intact. Solution looks good. It is not expired. So we're all good there. This is for his pneumonia. It's to administer every 24 hours. This is his first dose, so we're getting started. We will be giving it via IV piggyback. It's compatible over there with his primary infusion. I'll be administering this over 30 minutes. It's 50 mils over 30 minutes, so my flow rate on the pump is going to be 100 mils an hour. I will make sure to document this when we're done. Okay. So. This over here for now. Cool, so. Which one is that going? Huh. I haven't seen that one before. All right, so I'm gonna spike my piggyback here. Make sure I'm clamped off. All the way down. Get some in there. I can crack this if I need to. Great. Okay, so this is primed. And we should be good to go. I'm just gonna label my line set. It is 2:16. It's currently 10 a.m. Okay. I'm gonna put this up here, everybody can see it. Okay, great. So now I'll grab these guys and we'll head to the bedside. All right, Mr. Johnson, thanks for your patience. I want to do one more safety check and then we can get to administering this, okay? So one more time, name, date of birth.
Earl Johnson, 12/12/1938.
Great. And do you know if you have any drug allergies?
I do not.
Okay. So first up, I would give you this morphine for that pain. Now, have you had morphine before? You have.
Oh, sorry.
Okay.
Yes, I have.
Cool. So then, you know that it will likely make you a little dizzy at first.
I do.
So it should kick in quickly and start helping with that pain, but I just want you to be sure to use that call light and get me in here if you have any reason to get up out of bed, if you decide you need to go to the bathroom or whatever, okay? I just want to keep you safe while you're likely going to be dizzy.
Okay, thank you.
Yeah. Okay, so have you had any pain at your IV site lately?
Nope, no pain.
Okay, that's really good to hear. I'm just going to go ahead and make sure that everything looks good. Again, the primary infusion is running, so I know that it is patent. The patient's not reporting any problems, and upon inspection and palpation, I'm not seeing any sign of phlebitis, infiltration, other complications. I can see that the catheter is in place and it's intact, So we're all good there. I am going to go ahead and do my third check for this morphine sulfate here. So again, this is for patient Earl Johnson, that date of birth, and no allergies. Morphine sulfate, 2 milligrams here in my diluent. This is for an IV flush. It is now for pain. He's in pain. And I will make sure to document this after I administer. Okay, great. Will you just relax? I'm going to go ahead and get in here. We're playing pretend, and I'm not going to actually put it on the port, I guess. But I would scrub the hub. 15 seconds. Let it air dry. And then I would attach, again, this is the med syringe. And I'd start pushing. I would administer this over 5 minutes. And as I'm doing it, I'm monitoring the patient, making sure that they aren't showing any signs of any kind of infusion reaction, vasospasm, allergic reaction, things like that. It also feels good, so I know it's not partially occluded or anything. And I did forget, but I would have paused my pump before I got started there. So administered over 5 minutes, done there. At this point, I would then scrub the hub again for another 15 seconds, let it air dry, and then I would take my normal saline flush and go ahead and clear that line into his arm. I'd be infusing at the same rate that I had for the meds as well. Okay, done there. Great. Okay, so now I'm ready to administer the antibiotics. So again, this is for patient Earl Johnson with that date of birth and no known drug allergies. Per MAR, we have ceftriaxone. It is not expired. It's 1 gram in 50 milliliters. I'm supposed to be administering every 24 hours. This is his first dose. It's for his pneumonia. It'll be going in as an IV piggyback through this normal saline primary, which it is compatible with. I'm supposed to administer this 50 mils over 30 minutes, so I will be setting up the pump for a flow rate of 100 mils per hour. And I will document this in the MAR when I'm done. Okay, so let's go ahead and find the distal Y here, scrubbing the hub. And so that's air dried, I can go ahead and connect here. I'm going to go ahead and put the primary down and leave the piggyback up. All right, so we're all hooked up, and now I can go ahead and channel select for a secondary. I'm going to go find there's cefazolin. There it is, ceftriaxone. And I will punch in we're doing 1 gram in 50 milliliters. Next, at a rate, at a duration, 30 minutes. Come on now. So 100 milliliters per hour. Volume to be infused is 50 milliliters, so this will run for 30 minutes. All right, cool. So Make sure all clamps are open there. And then, and start. And we're ready to go. I'm going to hang out and make sure that I am seeing a drip in the piggyback and not in the primary. And that's my indicator that everything is running as it should. Okay, so Mr. Johnson, hopefully that morphine will be kicking in here in a sec. I've got your antibiotics running. I'm just going to step over here and do some documentation, all right? Okay, cool. So we can get rid of that stuff. So on the MAR, I initial that we administered the ceftriaxone at 1000, also here at 1000. We gave morphine sulfate. Okay, cool. So we are documented. All right, Mr. Johnson, again, I want you to use that call button if you need to get up out of bed. I also want to know if the IV pump starts beeping at you, okay? Otherwise, I will plan on being back through here in 20 minutes or so. This should be about done by then, and the morphine should have started kicking in as well, okay? But do let me know if you're feeling funny at all. I don't expect you will, but just in case. So, your bed's down, your guardrails are up, and your call light is available. I'm going to leave you to rest, okay?
Thank you so much, Joey.
Thank you.